What has been the most significant change you experienced from being involved with this program or project?
I would say it would be the knowledge that I've gained. Uh, when let me just backtrack a little bit. When I started and everything, we had with the youth build program, we had a loss. We had a major loss. We have one of participants who he overdosed himself, and I reached out to administration, and I said we need to be trained. We need to connect with someone that would help us that would help us so that we could be more prepared to provide services to our youth. And my first meeting that I attended was in Denver, Colorado, and I was very impressed with the staff. I was impressed with the staff, and I was impressed with the knowledge that they knew about youth. And I remember I went back and I told Cynthia, yes, I think we're in the right direction because we need to provide services to our clients, to our
Mhm.
youth, and yes, that's my first impression that I had with the connected program, and it's been good. Yes, ma'am.
How will this change affect you in the future?
It's gonna help us. It's gonna help me, and it's gonna help all the staff. It's gonna help all the staff and everything that we've been getting knowledge about the awareness. All the, I mean, I've been in the job training for 31 years, and I did not know of all the need, the services, like being in a rural area. I didn't know the uh, how much the services needed. We went, Alex, you were there also. We went to the job fair in Eagle Pass, and just the way the people came out, and then I was just surprised the conversations that they started. I never knew that there were so many youth that they're asking for help. They're
Mhm.
asking for help, and but we didn't have the resources, or maybe I didn't have the knowledge to provide those resources, referrals, and everything. And now with all the partnership that we've been getting, with all the partnership that we get, the reliance trainings, the coaching calls that we do and everything, it just has opened up it just opened up and everything so that we could provide services and refer our clients. Another main thing is that making awareness in the community. We have reached out to our local partners, to our workforce, to our health providers, to the school districts, and we met up with the counselors. And wow, now that I'm getting into this topics, I've been surprised. The need that we have to provide the services in our community.
When you were younger, what did you want it to be when you grew up? What were your hopes for your future right now?
I always wanted to be a coach. I love basketball. I
Mhm.
love basketball, and I wanted to be a coach. That was my dream, that I wanted to be a coach. And let me just tell you this story. I don't know if I'm a little bit out of line. When I graduated from college, my degree is in teaching. I applied at the school district here in Crystal City. I got hired here in Crystal City. The only reason I didn't take the job is that my rotating teacher, my rotating class was gonna be my wife. So I said, I don't want to be in the campus. Then I'm gonna be rotating students with my wife. So that's when I started working at the employment office, and then this position opened up with Med Incorporated, and I started working here, and I've been here for 31 years with no regrets. I love working with students, and I like to help them uh, develop their career pathways. We graduate a lot of students. We send them to a commercial CDL driving. We get a lot of medical assistance. Uh, we've done wonders.
What are your hopes for your future right now?
Okay. My hope for this. Okay, I'm looking forward to getting the other grant for Youth Bill. And I want to be able to provide more referrals. And we need, okay, I don't know if you're familiar with the youth bill and everything. Youth bill is many students, the majority of the students, or all the students, they don't have a GED or high school. So that means they dropped out. So that means they went through the cracks of the school system. And many of those students, they need services, they need help, they need help. So they need help. And those are the students I want to be able to reach. And with this learning experience, that we've learned through Connected and everything, now we're going to be able, not, not, we're going to be able to see, when they come in, we don't know if they already ate or something. It could be depression. It could be stress. It could be that they have low self-esteem, uh, things like that. And I want to be able to work with them to help them out and just start a conversation about mental health, that it's okay to talk about it. Here in South Texas, the machismo comes in. Many of the students, they don't want to talk about it. Now, I don't have depression, but I've seen now that, I've been learning about it, reading about it and everything, and I see the importance. And now that I've been meeting with the school counselors, when we talk about it, those services are much needed here in our area.
But what has it been like to be a part of the Connected Learning Network and the Influence Institute?
It's been a learning experience. It's been making me aware. We got to meet a lot of good people, a lot of people that are knowledge, that if we have any questions, we can call and ask. They give us guidance. And the other thing that I need to bring up, the van also. I mean, they provided the van and everything. The van is full of resources. That's the van you use, Alex, and it's full of resources. I mean, when those two job fairs that we went to, health fairs at Centro de Salud, and then in Eagle Pass, you saw over the way we were welcome, the way people were going to us, and we had a lot of resources, and they started calling us. They started calling right back, and that week or something, we already had like 7 bookings that they wanted us to participate because of all the information and resources and everything that we had on that map.
Has there been a time where you felt like you truly belong to and connected?
Excuse me again. Ask me that one again.
Has there been a time when you felt like you truly belong and connected?
Yes. Yes. When we're talking to our students, to our young adults, and that we're helping them, we're noticing the change, that just the main thing here, just by bringing up the conversation that about mental health, and they're opening up to us, I feel that we've done wonders. Because honestly, for the past 30 years, I had never been associated with mental health or things like that. And now I see students, when you start getting to know them, and then you start talking to them, and the main thing that I've learned is listen to them. All they want to be heard.
What has been the most significant change you've experienced from being involved with Connected?
Awareness. Yes, awareness and knowledge. I feel that we, not only me, my staff, yourself, Alex, we have gained a lot of knowledge. We have gained a lot of knowledge on, to be able to detect, when they're depressed. Sometimes the student that we lost, it was because of a relationship. And those are things that I feel that we're getting more prepared, so that we could be able to see students when they need help. Another one, partners. I've been amazed with partners that we just call them up, and they're out there to provide services, and they know that we're working together because we just want to help the best. We want to help and provide the best service to our students. One of the main reasons that I reached out to the administration is when we lost one of our students, and he overdosed. And I still have it in me that I feel sad. And it hurts. It hurts. And I know it hurts for the family. And he was doing drugs. And I never reached out to him to, ask him. I wasn't prepared. And now with all this trainings and everything, I feel that I'm more prepared. The other one, the second one that I learned from the first, not the first incident, is that when another student came up to me and then he said right in front of me, he said, "Sir, I wanted to end it all." That's when I really started getting, okay, we need to get a help. We need to get a program that helps us out, that prepares us. If we're going to be having youth-built students in our program, we need to get prepared. So that was one of the main reasons that I reached out to administration, and they've been helping us. And I can't say anything. It's just, getting us prepared to provide services for our youth.